Morning, Blackwood. There are once again no confirmed or probable cases of COVID-19 in Nunavut. The total number of persons followed to date is 1,553, and there are currently 163 persons followed. I'm pleased to announce that we are now going to be offering country food in our isolation hubs. The program is in its initial stages, and we're just finalizing shipping and delivery to Ottawa, Edmonton, and Winnipeg. We're very happy to be able to provide a little bit of home to those isolating before they return to Nunavut, and hope this will make their stay a little bit easier. I'd like to extend a huge thank you to staff across the government of Nunavut and our partners at Nunavut Incorporated for making this a reality. As always, we do appreciate that the 14-day isolation is not easy, and thank everyone for doing their part to help keep our communities safe.
The next step. The next page. Ula sakut nalo na si kanero mayo nalo na taw si mayo hangito balo pasagiyaw yo hangito no badyo 19 talindik Nunavut. Katilima tugit ulo mi mo kawi saktaw si mayo 1,553. Ang maluman na 163 kawi saktaw ni sulipidak taw ngitun. Hoviat tunga nalo na sigun nakamatuid na utik sigun naliratay nulaktanin na khinik ta kuninga inutuviu gya hakti taw yo nito yung mivinni. Tana piliak taw litay nakto kamalo awlak ti taw niyo sa liktut Ottawa mot Edmonton mot Winnipeg mulo. Hoviat tugut atoy na utik sigun nakata sulang yakangin ninirisungin nik inutukay nakahak ti taw tilog Nunavut mo utilawin ningin. Taman na ayong nangin nasa kunak tugalawak tuyong may biminingin ni kuyan na may takay kanayak ti Nunavut ka makungin niya malapiliri katibo Nunavut tung kavikun ni kay mga nakaway magalawak tung ulo ni 14 ni tuyong may biminuto kay nakahangnek ayong na tuyong ninganik kuyan na may takatakoy ilaw kataw matanun aliyatan ak tumihunagit.
And I'll pass it on to Dr. Patterson for updates on the Nunavut's path. Thank you.
Good morning. As Nunavut continues in its path forward, I am pleased to announce the further easing of restrictions in the territory. On July 20th, all licensed establishments in the territory will be allowed to open with regular hours. Nunavut will also be extending its common travel area to include Churchill, Manitoba. This bubble is exclusive to the community of Churchill and does not extend to other regions of Manitoba.
Ula sakut Nunavut siru mo gya palego te haktillo ta huviat tunga nalo na si kanero nakama kasuyaw balya ni amningin ni kisulit ta beauty ta Nunavut mi. July 20 ta ko license sa haktulimat MRB Nunavut mi matuwi nga hatta ko nalalak tot ikakasiw ti gayot tangin ni. Nunavut tama awlabyo hatta ko namalak to kudya kalok Manitoba tana nunalito nga Churchill Kudya kalok asingin no nitok Manitoba.
The common travel area applies to air, land, and water travel and exempts travelers from isolation requirements in Nunavut or Churchill under certain conditions. Travel must originate from Nunavut to Churchill or from Churchill to Nunavut. Travelers must have not been outside either Churchill or Nunavut for 2 weeks prior to traveling, and travelers must remain in Nunavut or Churchill for the duration of their stay. Prior to traveling outside of Nunavut, travelers should contact the Office of the Chief Public Health Officer for Nunavut and provide contact information such as an address and phone number at the person's regular place of residence and a written declaration that can be obtained by emailing CPHO travel requests at gov.nu.ca or by going to the Department of Health's website.
Tako awlabyo nakdut pidyutilit hangatayukut nunakut imakullo. Tako awlak nakdut inutuga ito kay nakatakaya kadyangit to tam Nunavut ubaloku jakalumi ukuninga malito akata. Awlak tut Nunavut ngalutiku jakalumut ubaloku jakalumik Nunavut. Awlang natuk sila tano kaya kalaw sa madyang ito kudya kalaw o balo Nunavut makunik pinasa ako sini awlalaw ngingin. Aulak na tut no ga hang tut ko Nunavut me ko baloku ja kalum me tay ma aulak se maner mini. Nunavut sila tanu laungin nak mini aulak na tut how you ke lit ang touchman na hang nang itulere nak ang yokap Nunavut me kuninga nalona silutik. Hanok how you get be kun nak mangata so lutura ko tingit ang balo khalaw tingit ang balo na me ang yakahang mga ang malo titirak sumayumik nalo na erotimik pigyali ta sumunga karisayak ko titirak lutik CPHO travel requests at gov.nu.ca ubaloan na nang itulirayik ko karisayak ko tukisigyabing ano lutik.
When traveling by air, travelers are required to obtain a letter from the CPHO authorizing travel, or they will not be permitted to board the flight. Those who leave the common travel area outside of Churchill will need to isolate for 14 days at a government isolation facility prior to returning to Nunavut. I would like to take this opportunity to thank all Nunavummiut for their patience as we work together to protect our territory and families from COVID-19. Thank you.
Aulang na ako tiktak ko aulang na ako titik kamik pigyali tat sumang angik tago timik aulang nak ninganut ubalo ikigahak titaw yang ito hanga tayo mo tayo maangik timik titik kata sumang ito akata takwa no to ang kata aulang begun nak tumisila tano ko jwa kalop ulo ni 14 nik inutu kay nakakakayak to ka makunal na simayangan ni to yung mevimi Nunavut mo tilaw miningin ni Pivirahamnan ni kuyan na may kay nakumayaka Nunavut may ulimat. Utakigun na siya si mata. Piliri katigi tiluta sa pumiya hulugo Nunavut ilawulo. Tamanga tapang ano ba dyan 19. Kuyan na may.
Ken Driscoll, APTN National News. Minister Hickes. This time last week, you said you were hopeful that you might have something to announce about continued airline funding, and you didn't say that today. I'm wondering, where are you at with continued funding for the airlines? When can we expect to hear an announcement?
Ken Driscoll, APTN kung nagpinasa ako siya yung may kayo gawit ako hanga tayo ulit kundo. Kinaw yan kayo tinatuin na ako na chutita ba ni pinasa ako sa minalaw na sa katangin na hanga ko gayak kalitaman na.
Thanks for the question, Kenton. I know negotiations are still ongoing. From what I understand, I am waiting for an update. And I probably could grab my phone, and I had just asked for an update earlier this morning, and I haven't gotten a response yet.
Kaya namin kaya takwa suli aye ko tao yun manamot suli to sa katsakang ito nga kasi ani to sa kaya kamakaw galawak to nga suli kiyo piyo kawin nama.
Koyan meet for the interpretation. Dr. Patterson, please. Dr. Patterson, this is the time of year where we get a lot of airplanes, smaller distance airplanes that ferry across the Atlantic by coming through the north. You get them coming from Europe to here. The smaller planes, you'll see them at the airport frequently. There was one there over the weekend. I'm wondering, how are you going about quarantining those people from outside of the region who are basically stopping just at the airport?
Luta Patterson. Takwa hanga tayo kalani tikibiw kayo kata ayak ko solo tayo jwa nga tani nga tunik tamak ko amikiyo taw na sa katak sa hanga tayo tamani to kalaw mi manungwani hanu ta ko inutu kay nakita katak tiki katak to hanga tayo kalako.
Thanks, Kent. We've been working with staff at the airport and the FBO, the private company that services those planes, since January to have protocols in place when there's either international diversions or, as you pointed out, the aircraft that are being ferried back and forth when they're coming through. I'll let Uli interpret and then I'll finish up.
Yun na may kanta ko kanayak ting hanga tayo ko bimi ang FBO unarak tayo ko tay mga ni January mi kayo say nakatak to tama nga kasakto kakaaktillo pinwak mi tayo jaki ani ngakto ni.
So we're in constant, regular communication as soon as either the airport or FBO knows about those planes, where they set up communications between my office and the other partners. We've worked out protocols to limit the risk, and so if the plane is just passing through, they're fueled, refueled, they don't go anywhere beyond the FBO's offices. And if they do get weathered or mechanicaled or need to pause because of duty hours, the FBO has a B&B and they go into there and they've got procedures to get them to the B&B and back with minimal contact. And there we're in touch with them throughout the whole operation when it happens.
Tako tu sa makatikain na tu tako ng FBO kung nga tayo kuti may kanayak tayo unik tanalo alabi nga asingilo pilari katayo malit siya katakto at malit tayo galinik tamak ko ako sa patu tako katako nagit sulok o sa gyak tutuin na tilugit palo ni tatsuma asya ninu katangit tu tatsuma FBO nguna tayo kasi ay sila pidyo tigilugo palo asingin dik surloy kakangin ni sulit sistema kata kangatayo ako tingin tay kanito yung mi hangata FBO kunni tay kung ngatuin na katakto asingin nulaw katik tako asingin ni takulo atay lit tayo katakto ako sa tuin nakto.
Dr. Patterson, when you look at the information from the Mary River runway, from the airport there, there's a number of direct flights that fly from Mary River to Iqaluit and back every week, and even before the diagnosis or the suspected diagnosis up there. What I'm wondering is, that mine's supposed to be isolated. How do you keep it isolated when they're flying into town so frequently? And I'm wondering, are they falling under the same regime that you described earlier with the ferried flights?
Luta Patterson tako ila tu sa nakatangan nuluyan ni ngakto ikalunot utik takay nakatangata tapaw nga to kakto ti pinasa ako si tamat tava ni pasagiyaw yung kalaw tilugo nalo na tawlaw tu galwa nuwadyo anak to hangin ni nga ni kako alo inututi tayo katang ninginik tako kanu maligya kakatak katamang nako sa kay mata.
Yeah, it's pretty much the same. When they're doing staff transfers on those flights, the staff, like the miners, do not leave the plane. Most of those other flights are for ferrying air crew or cargo, and so the risk is managed in a similar fashion.
Itay matsay na tako asingin ni nga tu hangatayo tikikatak tu kanayak ti kito naktakto amalo tamakko ako sa tu naktilugi hangatayo minungit siya katakto tako alo hangatayo mi kanayak tingin amalo pigalat taktilugi tay man hangatayo mi nungit siya makakatakto.
Rajni Sharma, Nunavut News. Dr. Patterson, the Mary River mine case was identified as a presumptive positive case, and the Pond Inlet case was identified as a false positive. Can you please just explain the difference between the two terms?
Rajni Sharma, Nunavut, Bibalaya Kuniluta, Patterson, Okakam Nakita, Nanuluyani, Naluna Tolo, took a mapasagiyaw to Nam Rakta Luni, Amalo, Tanamit Sematalimit, Tamakita Luni, Novadjoanak to Hamnaralo, they are digging in the house of Haunaki.
Remind me to pause for interpretation because
Yes.
this will be long. So false positive was initially declared positive and in one test only in the lab in the south. It appeared to be confirmatory, like confirmed, definite. But there were a few things that led us to declare it a false positive. Number one, with repeat testing of that individual, they were all negative. Number two, with repeat testing of the original sample, it was negative, and there was no infection around the individual despite several days delay. So that's why we were comfortable in saying that one was a false positive.
Okay. Tako tamak sutik, tay manu pa dyan nang nakatayo kataktot, kanaking kanlunano tayo lauk tinagusuli, tay manalo na tayo lauk tayo galawa tay ma, ano pa dyan nakto katoy na hamningin no kasi ani makuling akatangatik, tamak sutik, no pa dyan nakto hang nakatayo kataktot, tamakko, nalo na nakatayo kan nakataktot, amalo ay pa nga, tana, nalo na tawlo tay manu ba jong nakto hangin ni nganik tay maulo ka sa king ba kaya taw sa malaw kalo atilugo nalo na tawlo to tamak taw na tawlo ni no ba jong nakto hangin latta ko ni ngani.
Presumptive refers to a result from a lab that has has achieved Health Canada approval or approval through the National Microbiology Lab, but has not got the complete validation on positive results. And if you think back to late January, February, the initial lab in Canada that could do COVID testing was the NML, or National Microbiology Lab in Winnipeg. And even initial results in Ontario and other jurisdictions were sent to them for confirmation. And so when those jurisdictions started doing their tests, they would announce as a presumptive and then get confirmatory results from NML. I'll let you interpret that part.
Takwa pasagiyaw yu tema nuvadyanak tahaktu ni anik takwa ulak titawin na hatalaktut ane hamnang ituloy na mangit taw si mayumut kawye sakbi uyumut tay kanika na tami ang sibi mo kawye sakbi juami takwa nalo na taw si mayu January February ma ulak titaw hatalaktut tabunga kawye sakbi nga no Winnipeg mi kingunia go Ontario mi nga to alla tabunga ulak titaw hatalaktut nalo na taw yakan ne khullugi pasagiyaw yu lutak kunungan ulak titaw hatak kana tami ang sibi jo ala kun.
In the case of the lab in Mary River, we can technically only call it presumptive when we get a positive result from them. And the reason we can't say for sure that it's a false positive or something else, and the reason we're sticking to the presumptive is there were 2 separate tests that were both positive, and there was about a 4 or 5 day delay between getting the next sample and getting it tested. They're getting it collected and then getting it tested. And there's no, because they use different liquid to store the sample in, we can't ship the sample south to get it, even the one were positive, we can't get them tested in another machine. So we have to acknowledge that this case, and this is no fault of the lab, it's just really a case where we can't fully classify it into the current classification for infections, and so we say presumptive positive, but acknowledge that there's a pretty good chance that we'll never know for sure if it was a false positive or a true positive or what happened. And I'll let Uli interpret that part, and then I'll get to the other part.
Tanang eksibita pa ni nuluyani imanalo na sigutaw lataro nang imad kisani pasagiyaw na raktaw lutik tay mapidyo te haksuti pasagiyaw na raktaw at makwak te kalo aktilugi tay ma nukadyo ang naktaw law nga kisani nalo na taw gya kanyang naksila nga uloy sitama tali malo ni anigok simalak mata tay makingulam no taw gya kalaw nga takaw yasaktaw gutit sait takol tapane kaw yasaktaw guting at sige ngito katang ata kaw yasaktaw gutin no tamane kalunani lo tay may mat kaw yasaktaw gut naksiya kanila ngito tay manalo na taw lang ngingani tan kinam tuin na may pasiyaw yung hangito kasi at sige ngito katang no kaw yasaktaw guti taman na pidyo te kakatak.
I think the important thing, knowing that there's some uncertainty with all lab tests, not just Mary River, but all of them, and not just for COVID-19, but in the circumstances of a communicable disease, the appropriate response is to assume it's positive and to take the steps necessary to stop or break transmission as soon as possible. And working together with the mine, in this case, we were able to do that very quickly after the positive results came back. And so even if it was a confirmed positive, I think the actions we took and the end results would have been the same. Thanks.
Pimari umakaw makataya hamne butamani nuluyani tungito kisani taw kaw sa katang atasingin ni nubadyo anak tutungito ni kisani asingin ni taw siyang makunak tunik isa magyakakat tamakwa tay may tutuin na kahangin ni tay manok hak taw hulugin amalu siyang malak pala ako nagit pilari kataw siya katakto yang ni artiko hilami uyukut ala nalo na taw nakalawak ka tayo mano wadyo anak ta khalakin ni ngani tayo ma siyang magajalaw ngito sibong magot ano iligay ako tayo katsaw tigilaw kata.
Megan Dooley, Nunavut News. I'm wondering with licensed establishments being able to open normal business hours, is everything else the same in terms of 50% capacity and social distancing at the tables and stuff like this?
Megan duling nunat siya kunik takwa license sa kakto yemek biyo tayo matsay na matuyok tayo lalak tilugi tayo matayo abay nang inis inugya kak si malakas suli.
That's correct. They're allowed to open their regular hours, but the maintaining the distancing and staying at half capacity has not changed.
Tayo masuli yok mati lalak tilugi tayo matsay na abay nang ini isip tayo ila inukakon nak nini tayo maabay nang ini ugun nalak to suli.
And I'm wondering, it's similar to Kent's question, what kind of policy is there in place for employees who work at Canadian North and Calm Air, so when they land in territory that they isolate and they're not going to the grocery store and going to the bar and stuff like this?
Tayo matsay na kaya napik tatang at kisu wato agang itakuno kanayak tingin no Canadian North Kamalo Kame tayo maino tuga hakti tao tilugit surlo niwak mo katakunagi balo ani katakunagi surlo imek benno.
Anyone who gets an exemption from the isolation requirements, whether it's because of compassionate grounds or work or whatever the reason is, there's the same expectations that they are allowed to go to work. After work hours, they're expected to isolate at home. If they do need to get groceries, there's one trip a week to go to the grocery store, but that's about it. They should not be going to restaurants or bars or parties or any of those social activities until they've been in territory and have been well for 14 days. I'll let Uli interpret that and then talk a bit more about that.
Kinatuin na tayo matikigun na tayo si Mayo Pidyo ti harlotik surlo ilak tuminiw pataw balik kanaya harlotik tayo matsay na ni kayo giyaw viyuyut. Tako ay kanaya kaya kung nakto tamalo kasi ano tayo hatarlotik balo nini bila akong narlotik na kita reaktorlotik pinasa ako si tamad. Tako alo ani hatakaya hangito ni revinot imik binot balo asingin no ino katigino pabiyo hatakto not ulo ni 14 ni ani go jaw langin ng mini.
They individuals who, when they get an exemption, they get a letter detailing the requirements to them. We have had some complaints raised of people not following those concerns. Most of them have turned out to be people who have already finished their isolation. They're on day 15 or day 16 since they returned to the territory. And the rest have basically, we've had to remind them and educate them about the requirements, and that has dealt with it every time that's happened to my knowledge.
Tako akin at kikutuin na tikikun na titaw hatakto titik kata hatang atanalo na yak sa mayuni maligialing init malito kang nangi paila ilun nati kala malikat takto kalo ailang ilu tako inutugahan ng minik ulo ni 15 ni 16 late nilo ni payakik sa makatakto tay ko kasi nakay titaw gaya hatakto tay mamalit siya kaham ni inut anik tayo hatakaya kaham ng ulo ni 14.
And I'm just wondering with Churchill, again, is it pretty common for people to travel back and forth between Nunavut and Churchill?
Panapit yung tigil ko dyan, kalapit yung tigil ko nung nabumi nga katak, tutavong nga kayo ito kakatang ano nabumi yun.
Yeah, we're getting requests on a daily basis for, especially for residents of Aviat and Whale Cove to be able to bring supplies in by rail and then go themselves to pick it up is significant savings. And so we hope this will help them with that. And it's safe at the moment too.
It's safe at the moment?
Yeah.
Yullo tama tutsa biyo katak tugo pilo akto mi hakbiya mi uni tikirak dya mi uni lutaw bunga niyo bira katang ata nuna siyo tikuta bunga tikititaw sa mayuni ay tsakat kaya hangata tayo makikinak sa titsim matay at tanak soingin at tigo ang ikatak tabo.
When did you know that there was a worldwide shortage of cartridges for the Gene Expert machines?
Kaya lang sa mga binunak dyan, amigas siningin ni tat sa mga gene expert mo, kaya sa kuti mo.
I can't remember the exact date, but basically as soon as we first ordered them.
Kangan latang mga ulong kaya mangita kaya sibulak pa kami tikis ay tiluta, amigas siliri lang sa mayo.
When you first ordered the machines or the cartridges?
Tana,
Sorry, go ahead. Sorry, Lee.
tana, pilikid dyan tinga ubalo tayo ko, kaya sa kuti po, tao sunan le.
Mami anak. When we first ordered the cartridges, we've had Gene Experts machines in territory for years.
Takwa kaya sa kuti kulong ipok tao so tikis ay giyang ngakati ko tana le gene expert ngunak tao yung akay ko kasang napisimalak ta kalawang.
I should clarify for people who don't know, the Gene Expert machine has been used for testing for tuberculosis for quite some time. It's been, there's been one in Iqaluit for somewhere around 9 years now, 8 or 9 years. And when the COVID-19 pandemic started, the manufacturer developed the capacity for Gene Expert to be used as testing for COVID. And when we ordered those cartridges, we were told there's a shortage.
Takwa gene expert ngunak tao yung mo tana kung ipisimalak tao pupalun nak to mo kaya sak tao kata uti usimalak tao akago kasak ni tamani akalun ni akago ni 8 ni 9 ni lunit kasi ni no vadjuan nak to kalak tilugo tana atok tao gunak sila nga tana lo atok tao gunak sila ni no vadjuan nak to hangi kalo ang mga kasi ni taman na kaya sak tao guting ipok tao so tayo maamigak sila to no vadjuan nak to kapalalak tilugo.
I guess I'm just wondering, because I know that they were in place for years, but then you did the work to get them validated. So you did the work to get them validated not knowing that there would be a shortage of cartridges is what I'm trying to find out, because you weren't able to use them like you wanted to, I don't think.
Kaya magalaw ito nga tayo na ito atay na ito minuningan ni kisani nalo na ito kaya hamning ito amigak silak tilugo. Kaya malaw kasi tayo amigak sikat ta kaya nga tayo sa mga sunak ko tango yung.
No, we knew there was a shortage even when we were trying to do, when the work to validate the Gene Experts was going on. The problem is that the other two devices that would have been appropriate, there was also shortages or delays with those. So we purposefully have been pursuing 3 devices partly because they have different roles within the overall system of how we will respond to COVID-19, but also because for something this important, we need to make certain that we've always got backup options and contingency plans.
Kaya matsaw tigilaw ito amigak sikat ta ni kambalo ta ko nalo na ito kaya siya kan nakatalaw nga ta gene expert ta ko kaya sa kuti na kakta yun makukan ni kaya sa kutin ni pigaso si magalawak to kasi anita amigak si mataking overreact si makatak sutik pingaso ni kaya sa kutin kakalawak to gadjiging ito ni pidyo tao yunik takwalo kanor no vadjuan ng 19 matok tao gunak mga ta asingin ni atok tao gunak to ni piugun ni katato na hakamas si magata.
And then how come you couldn't use those machines to verify the person's test results from the Mary River mine? How come those had to be sent south if you have validated machines in territory?
Sumalita yung mata ko, sunak ko tayo hatilo si kawi ilan, nalo na yaksi ko tayo gunak to ni solo, nulo yaw yakam na biming ato ni sumakalo na anok tayo kaya kanilaw kan.
We validated for the presumptive status, but not for the confirmatory status. In order to get the confirmatory status, I think we have to have had, I think it's 15 positives that are found on our machine and confirmed in the south. And we're a victim of our own success because we're at 0. We haven't been able to do that.
Tako nalo na ito siya kan nakakatang ata pasagay yaw ito yung nakto galwa tamani nalo na sigum nangin nata nalo na sigum naksimagaya kalwak ito 15 o nga taano tayo nalo na view ko tao si malang nakatano ba dyan nakto hamning hindi kasi aritan na nalo na sigum siya kakatlaw ng nata tayo may naluna tau ga kan na hatak to kan lonani.
Thank you. May I please ask Minister Hickes one question? Hello. Can you please give me any more info on the country food? I guess who's providing it, and do you have enough in freezers in the different locations in the south now so that people can eat it when they're in isolation now?
To kasi gatit si kan na nakita ko ay nulak tanay nakita ta katalangan ng laknak tilawi. Kikuning nga mga tamalo at yung nakat siya katalangan ba na matun ko ako tingin ni kalunani.
Thanks for the question, Megan. And Kate and I were talking about this earlier. We knew the question would come up. Unfortunately, I don't have a lot of details right now. This was being worked on for the last little while to provide country food in the hubs, and how it's going to be rolled out and what types of country foods are still working its way through the channels.
Yun na may tanapik ko tiyo lang ang nalok kangin na ma ilulingin ni suli na kaya mangitong suli pili kaya ngo pala matatako no ngayon tubiyo kay nakatakalin no kalunani kanoklo kisunidlo suli nalo na si malaking ito nga mana yo pili kaya ngo valya sa katalangan.
And you mentioned that you're partnering with NTI to do this. How much money are they contributing, and how much is the GN contributing on top of additional isolation hub costs to pay for this?
O hakaw kami no butong gabit ko pili kataw na kasugi kano tigilit ako kinaw yan ikayo te hakat amalo ilit sa kano tigi ikayo te hakkas kinaw yan itamatong.
Thank you for the question, Megan. And although the food costs are going to be borne by the GN through the normal cost of doing the isolation hubs, Nunavut Incorporated is assisting us with the shipping.
Pardon me?
With the shipping?
Kaya na may genta ko ano na vuga makungin na kilak taw na akto galo akisa ni no na butong gawik ko kayok to awlak ti taw ningin no.
Beth Brown, CBC. My questions, well, Mr. Hickes, you're there, so I guess I can start by asking you. We have a question from social media where people are wondering about isolation and testing of staff at the isolation hotels and how often those staff are tested and if they're required to isolate upon returning home. But maybe that is a Dr. Patterson.
Hotel staff
Hotel staff at the quarantine hubs.
Beth Brown CBC kunik tanapik ko tilino to view kay nakatak to ni kalunani to job mi bin ni kanu tigita ko hawi saktaw katak kanayak tingi no ba jo anak to kang ikalo mga ta.
You mean the staff working in the hotels?
Yes.
Where they're residents of the jurisdiction in the south, they're not required to test or isolate, and we minimize the exchange in order to protect Nunavummiut from that.
Kanayak tingi ta ko to job mi bin ni taw na ni kalunani mi taw mata hawi saktaw ya to katangin mata kasi ani katisilo at tele mati katak tawo taw na ni to job mi bin ni tuning.
With the presumptive positive at Baffinland for Mary River, will that change the numbers nationally for Nunavut? Do we now technically have one case as far as stats? Are people going to see on television that Nunavut is counted as one, or are we still at 0 cases?
Kana pasagiyaw la to Baffinland mi ujang na bingani nuluyani. Asid jak taw lang abata na taw siyo ni kaktaw lo ni nuvad jo anak to kakto mini na kaktaw lo ni kanutan na lo na taw si malanga ba.
Thanks. This one gets a bit technical. There's a set of definitions, of case definitions for terms that we, across the country, we try and be strict about sticking to it so we can compare, so that we can work with researchers and epidemiologists to monitor and track data. And the two that get reported as what most people think of as cases are confirmed or probable. In this circumstance, presumptive doesn't fit the criteria for either one. So federally and for most other jurisdictions and most reporting, we go back to 0. But understandably, it's probably best 0 with a question mark or an asterisk beside it.
Hoyan nami tana ayok nagalattu galaw kausari gaswar lugu kisani nalunayak si mayunik tema nalunayak si khattara khatatamani kanatami tana lo malit sara haksutigu ammalu ajiging inning khimiqu khattarlu tatamakuninga ser masunik khawi saktinut khawi saktaw vallalu tikhanuitu mga tasurlu tama na pasagayaw tuinak tuminiw galo tamane gavamatu hakkunni ammalu avittor sima view yuni Nuvadjuanak to hangit tuminiw ni ngano tayo nuvadjuanak to halaw si mangin itinik nalo na si magunak tugot kasi ani apers ila apers nalo na tayo sa malaking ningan nalo na tayo sa malunit tayo makisi ani kawi saktaw law to.
The other thing to keep in mind is that this individual may have acquired it in the south, not in Nunavut, and so that also affects which jurisdiction it's reported as coming from. So again, another reason that we drop back to 0, but that's not the most important part of all this. So.
Tanat tayo sa magigiyakang medyabu sulo kanlo na ni tayo manuvadjuanak ta tuminiw but nalo na tayo sa magigiyakang kanaliani abitok si mabiyo yun ni kanata minuvadjuanak ta tuhang ng mga tayo may mat 0 minak tayo yunuvadjuanak ta harak sa mangin nga ninunavumi asingin nilo tayo nalo na tayo sa mga tuwin na kaya hakto ni.
Given that the cartridges or the liquid that was being used by the mine was incompatible with the hospital here and the labs in the south, will there be any changes or direction in conversation with the mine to suggest that they make their testing setup compatible in future so that we don't have another repeat situation?
Tayo mga sa manak tilugot ako akawi sa kutiyo yun sulo imangi tamang mga ana belo mo ambalo hallo na no kawi saktaw gun nangin no tako yakang nertiku asid ko jaw kayak tay ma kawi sa kutin tako ajigit say na kullugi ibbi kawi sa kutingin ni.
Right now they have a supply of swabs that are compatible with our machines here in Iqaluit and in the south, so if it were to happen again they could immediately re-swab the individual and send that swab to us for testing. As far as their ability to switch the media, I don't know yet if that's a possibility. We'll have the conversation with them about that and other lessons learned from this later this week.
Mana yutako akawi sa kutiyo yaw lak tayo hatakto tayo ko ato nakalekto tamane kalon ni amalo kaluna ni kawi sa kutingin no kawi saktaw gun naktunik tako awlak tayo lekhikan na hattara hangata nalo na tayo gaswak tilugi tayo mag adjiging ito ni kawi sa kutino ato nga hattakon nakto tamakwalo ili gutigi balle ayabo suli malipalle ato na lang ayabo na kwakaw naksaw balle na mga.
Did the government give those swabs to the mine or did the mine purchase them?
Kava makkuno tunisija mini kawi sa kutini ubalo na mini uvekto mini uja nertikon.
We sent them to them free of charge.
Awlak tayo lak to akikaktin nagi.
You announced that licensed establishments could be opening up for full hours. Can you explain what you mean? Does that mean bars and restaurants, or does it extend to other businesses?
Ako license sili imir biwjut matu nga kattaon na nakakaw gavigit neribit inabilo tayo maigum naksiyo.
It means any restaurant or club or bar that's licensed to serve alcohol. Those are the only ones that we had still had strict limits on their hours of operation, and so we've removed that limit, or we will remove that limit next week.
Nerivit imirbilo ni tako imealon ni atu niuver chaha khattaqtut sulit tabbehar titaw law ngatay kakangin ni tako isulit tabbeu titaw ning ikakang ipinasa ko siula to me khuya na taw lalak to matu nga khattaw na lo di kakakhattalaw tangin ni.
You've also announced an opening up between Nunavut and Churchill. You have said in past that it's not possible to open up a travel arrangement between Nunavut and Nunavik, or between perhaps Iqaluit and Ottawa. Why is it that you're able to open up a territory with one jurisdiction in another province when you said that wasn't possible before?
Tana matuyot lang ngat ko jwa kalong mi Manitoba mi te may gumnak na kailaw ngin na bita ko alo aw lahat ako nak nang matuyaw sa mamata Nunavut amalu Nunavik amalu Iqaluit arawamut sumalitan na ko jwa kalong tay mamatuyot taw gumnak sitakha.
Well, first off, with Nunavik, we've mentioned in the past that we're in discussions about a travel bubble with the public health officers in Nunavik, and that's an ongoing conversation. The difference between Ottawa and Churchill is that it's more difficult to travel into northern Manitoba, and we can be pretty certain that in a small community and having conversation with health professionals in the community that there's no COVID in Churchill, whereas it's impossible to be that certain with Ottawa right now. So that's the reason why we're comfortable doing it there, but not in Ottawa.
Tana sibulla pa me Nunavik me o kakatibo tay mag awlak be o kataw nak sila mga ta sa ano katang ilutik na ana nang ituloy ng mo pilari katinga Nunavik me o kakatigi valengin nak tanga tagnalo at jiging matiarwa malukut sa kalok at takwa mikiyo ningan dana ko jwa kalok ana nang ituloy ng mo pilari kating ita wani nuvadjuar nakto kalaw ng mata malupim makiyo mat arawa mi dahil nuvadjuar nakto kalaw ni palet sa alak katakisiyan isumalo ila isumat saksiro tiyo kung nalaman.
I have a question from people watching asking about the hotel hubs in Winnipeg. They're saying that there could be a wait list of as long as a week, and they're wondering why that is, or if there's any move to make those hubs, to add rooms or another hotel.
Apek ko tiyo yung hakisaw yak kutaw na ni Winnipeg may pidyo tigil lugo utak kakataka hang katagoy ni kangin ningin no to yung may VP na sa ako silimani ila sila mga piasingin nito yung may binapere yung hakto.
If it is that bad, and do you want to? That's an option that we've done in other communities, but looks like I'll let Minister Hickes speak about that.
Thanks for the question, Beth. We are working with Community Government Services on our contracting to take a look at the numbers and the demand and to see if additional rooms can be brought into play. That is one of the main reasons why we set up the longer-term isolation request, so that people do leave the territory, they can let us know well in advance so that we can work with the numbers. What has been happening is, unfortunately, people haven't been communicating their advanced travel plans. So then they send in a request that they're ready to go in tomorrow, where all of a sudden we get 80 people doing that. It has a dramatic impact on the demand and availability.
Yun na may takwa no nalinigawa magkungin lopit sa kati kung gawa magku contracting na kimik ko yung mata katsiw ga ka mga ta malokano tigi hupat daw gumang mga ta ila sige hakot talo ilo ko sernik tay mag apik ila tamak ko tut sa kauti yo ino to kay nakataka ham na mo nalo naksakatang ata ilang inalo na sa katang imata siwo ngago tay mautak panlagi kalam ng minik surlot takwa edi uni aktilog itako ini karon ni katang at tamak ko kingo waktu tinalo na sa katak to tuyok may bimikay na kaya haknain.
So just to finish, Beth, I would strongly recommend anyone that will need to utilize the isolation hubs to book their travel plans as far in advance as possible, so that we can work to meet the demand.
Maybe ko tigilo ko tayo matulog ko viewok na tuin nak awlak si mania to ako ni utir na to ako ni tako ino to kay nakahabyo yun ni kawi kay sa makatareali si bongago.
Okay. With the hubs too, direction has been so far that for people applying to do the isolation, this has been a process that they agree to do, they sign paperwork, they're working with you to do it, and you have said that it's not a mandatory process. People don't have to go through the process, but they have to in order to come home. I'm wondering why it is that you're telling people that this is something that they do freely when it's mandatory to do the hotel isolation in order to return home.
I don't know if I got it. Tako ino tu kay nabiyo katak tu tayo mati la yaw katang ata tutsira katako yaw lutisi bong wago tako alo pay pala rin ang mo asego bakakati kino tu kay nakataya harning utak palya tilugit tayo mangik kakpalya na alak tilugit. Sumalay sumay nakititaw ba malunalo na sa kataya hangila sibong wago utak palya law nginingin eh.
So, and I guess that's subject to different people's interpretation, I guess, Beth, but the way I look at it is people, when they do leave the territory, everyone's well aware of the isolation hub requirements now, and we're making them available. So we're not allowing people to come to Nunavut. We're just putting a requirement that you need to go through this process to travel to Nunavut. And I think the biggest thing that people seem to be forgetting is that there is a strong recommendation for non-essential travel to travel south. We strongly recommend people to not travel south. And this is not normal times. It's an inconvenience, it's a hardship for families to not be able to connect. But these are unprecedented times, and we have to take those factors into consideration when we make our travel plans. I know I've canceled my travel plans this summer.
Tako ajing ito ni tukisi jaw katang kata malitaw gali solo aulam na kata no na vumik how ye magyahang kata ilay no tu kay nakataya hamningin no tilaw ningin ni tay may mano na vumian aulat tele kata ko galo akto go sangi yo may atule ko yisi mayogo pimakayong ito ni pidyo to harlutik aula kata ko jingi kalo kata man na yo ajing ito ko laki kata malo ayong naktukuk suta tay may tukulaw si magata tay may mat tanan la no kakit siga khasma ya awla ga khawti minigalo ngin khalluna no tamanna awla tayli ga khamne malitaw ga khagalo amne ngano pedjo tigillugo.
A lot of people seem focused on the inconvenience and the personal impact. When we look globally, over 500,000 people have died from this virus, and we need to really take a second look at what our choices are moving forward on how this is going to continue to impact us personally, community, territorially, and nationally. So I really hope that people really take the time to really seriously reconsider whether they really need to leave the territory or not.
Okay.
Wait. Taman na pedjo tili akakya ngit ko kalwak tilugo ino sang minute how ye magahakata 1 million abangin ni tuto ko simalang ngatanon aktuali mami isimasaksi ko takatsaka hakatanali ka ko titinik kanuklo at tuwin ang mga uwatinnik nunalitinnik ka natamilo kaya may isimasaksi ko kanit siya katakili awla kaya halaki kalo ang mga ati awla kaya halaki mga talon ni.
There are a lot of people who have changed their travel plans and who are cooperating because we understand that there's a pandemic, but we've heard Dr. Patterson speak about the Public Health Act and how you're talking to lawyers. We've seen the NWT change some of their act because of the Charter of Rights. My question more simply is it legal for you to tell residents that it is mandatory for them to isolate in a government-sanctioned hotel for 2 weeks in order to come home? Is it legal for you to tell them that it's mandatory?
Kasi just si malat tilugi tamak ko ang ila misoy kayo sa kalwak tilugi na at sa kalwak tilugi lo at sa maluluta Patterson anna hang mangituloy ng motili yaw tigis si mayanga maligali kayo no kimiko yaw si mat sa kalwak ka so lo kanatami pidyon na tingin ni pidyo te hak tilugo maligak tigo malit sa kalwak kasi ay go behang ito mino to kayo nakahaktit sa katang ni sa kalunan ito yung mebin.
Thanks for the question, Beth. And again, I'm sure there's differing opinions out there, but the way we've interpreted it is through the public health emergency, through that legislation, it does give us that authority.
Kaya nami bata ko adjuging ito na isa magijaw hatak to galo kasi ana ham nang ito lere ng moto avek ma to hakti lugu pe ko yakti ko tay ma piyun na te khatsa to go pe ko jay malit to git.
Is it legal for you to charge people, as you originally had said you were going to charge non-essential travelers? Did you, and that the answer was that we didn't charge people because of the logistics of out of jurisdiction managing that, but would it be legal for you to ask people to pay to stay in those hotels?
Pay for what?
To pay. To pay.
Tako pasiyat sangot tit sigun nak kasi maligak tigo tamak ko malitaw ngito katwalang nakatay makilit sigun nakayak kasi.
That's a good question, Beth, and again, as the main reason why we didn't move forward with that was the logistics and the return on investment, if you want to call it that. There was some questions, again, around the legality, mainly from a point of privilege. Some people could afford it, some people couldn't. So it put some questions in our minds about that, but the main reason was the logistical factor.
Inta na pek tit siya babat. Sumalita makwa kitaw si makatang ningin nod ilangit. Pero yang ni malit siya kalo mga ata ilang ilo. Taman na piyun na te khatsa no pidyo te khasuni ilangit. Akiligon nat siya kung nalaw tugot ilangi akiligon nat siya ati ayok sam ner sa malkisani te ma ayok nangin na pangon ng ano tay ma tuin na tit sa khatak tugot inutuvyo kay nam nato nito yung mabini.
Ken Frisco, APTN National News. Dr. Patterson, when you were answering Megan's questions about basically essential staff quarantining here in Iqaluit, you said there were some people who, to use your words, needed more instruction. How many people needed more instruction?
Ken Frisco, APTN kun ni Megan at kutig kaw yang tamak ko api Mario yun kanayali tikiti tayo khatak ningin no. Tay mailangit tilijaw siya khatara ham ningin no kano taman na nalo na yakon nakyo.
I don't know. We don't keep track of it in terms of a formal response, and a lot of it is just reminders. We're talking, trying to get people in some cases to break, habits that they do in their daily life for 40 years and just stop that for 2 weeks, and that's difficult. And so we're not trying to be, for the most part, we're not trying to be punitive or anything like that, but sticking with education and reminders.
Kaya man latang ito nga kaya sakta wala katangin matatitikta wala gatilo. Kasi ni kahit siya katara hakatatamak ko sa kumitsi katara tayo matutugi gayog tamin na yung nasa katanga pero akto may ulo tamakan ili kusingin ni kakago ni 14 makoy na ni pinasa ako sini tayo maayong naktugalo kasi ni tayo nalo na siya nga kataktugo ilid na reaktit sinik ko tamalik kahit siya ko malitaw galin.
Could you put any finer point on it? Is this something you have to do weekly, a couple times a week, once a month, multiple times daily? Could you put any sort of finer point on that?
Sure.
Lalo na ikakakan na kung nakyo. Kano tigi mga pinasa ako si tama, makro pinasa ako si nagay mataulo tama. Kano tigi taman na kahit siga ako tao kataka haka.
I get people mentioning things to me more than once a week. But again, some of them turn out to be people have been isolated for longer or mistaken identity. So I don't know how many of them turn out to be things that would actually concern me in terms of not following the isolation in that 14-day period.
Kaya kataw katakto nga pinasa ako si tama makwakti ungatanullo ni tamako inutuga hakti taw yani tayluga hakti taw yut umpalon ni tamak tuti tanaw ngittumik tan isamalo ti gilaw katang itakaulo ni 14 nagay matatay may sumay nakis kattaw naksi katangata.
The Globe and Mail has been running a great investigative series about Canada's response to COVID-19. And in the one they published back at the end of June, they quoted some experts, and the experts said that we need to be 10 times more prepared for COVID-19 in the fall than we were in the spring for when it comes back. And your estimation is, when it comes to personal protective equipment, testing capacity, will Nunavut be 10 times more prepared come fall than we were in the spring?
Takunan in Globen Mayo, Pivalyayo, Kalimagang in Kanatao, Kamagayaham ning aning Nunavut 19 mo June, Nungani Ulak to Harji Mayitamnik. Ukak to halaw nga ukyat sa amigo huli rakto mi ka udjusut sera ham naksaula at tataman na awyaw ni nganik tamak ko pidyo tigil lugi timi mo sapum miyaw guti tamalo kawi sa guti at upalong ayak si matsya lekano na vutay ma kawi udjusut sera halam nung mi ukyat sa mo.
We'll certainly be much better off than we were even a few months ago. We should have a storage or cache of personal protective equipment that we estimate could last 3 months if we're using PPE everywhere across the territory at the same rate, so even in all communities. We should have at least 2 diagnostic devices in territory functioning to provide most, if not all, of our diagnostic needs. So yeah, we will be much better off by September or October than we are even right now. Thanks.
Akakaya na saula kayak tigo takhiula to ni na simalak tilugit. Atu nakat salak sa tatok taw sa mayunita magkuninga temi mo sa pumiyaw ko tinik takti pingaso si mayutay mano at sivala ila. Atu nakalayak tigo tamani no nalilimani makunil lokaw isa ko titakalak sunin tamani no nabumi tambalo ilu na tikasak tamakko na lo na taw sa matsalak tilugit taman nakakayak na sayo ko pilo akto me September may October may lu akakayak na sa makilak tigo palong sa manak sa ulo talo.
Rajni Sharma, Nunavut News. Minister Hickes, is there any possibility the GN may stop paying for self-isolation fees in the future, or is that simply not an option?
Rajni Sharma, Nunavut News, Kundik Minister Hickes, tako Nunavut Gavamakungit, Nukalak Surivigi, Tamakuning at Tuyong Mivim, Yakilak Suikatam Namu, Inutukay Nakahak Beauty Tau Uni.
I don't like to say never too often, but I would say it's highly unlikely that we would be looking at charging people for the isolation.
Tayo may law sumadyawan lang ito ko tamakwa akilak suy na lang ayaw inutu beauty tau yu tuyong mivi kau yimayangag.
Maybe I missed this, but is there a certain budget set aside for the country food? And if so, how much is it?
Kinaya niya tuktot sa nilalong na sistema yung katamak ko nung ngayon ulak tano nikino ato yun na titaw katalang ayun balokat siya karne usaba.
Thanks for the question. There's not an established budget. We'll be taking it out of the food budget that we have allocated to the isolation hubs. It'll just be part and parcel with our food.
Kuya namita kuning kinaya niya tuktot sa liok sa mayo hangito kisa ni nikilirin ng mat kinaya tuktot sa nik ilagi jaw yuta kunong ino tu view titaw galin ni.
I think part of that also, just to close out that question, the feedback that we're getting is constantly monitored from the isolation hubs, and one of the concerns or issues that was brought to light was access to country food. Some people get family members to deliver country food, and obviously that's a challenge now with the isolation hubs with the no contact. So we listen. We're truly trying to make things a little bit more comfortable for people through this 14-day isolation. I know it's not easy.
Wait. Ilagi jaw yu taman na to sa kata kano isumagaya kang mga kawaya sa palangin naksitigo taman na ismaluti si mamato na hakunam ni inulak tani na kinik ilang ito yung tayo katakto galo ilang inu kisa ni taman na yung naksigalat sa malanga katiga hamning inu tayo may manalat siya kasi katakto ko tamalo ulo ni 14 ni tako ima ayong nangit tuminak sa utik palak sa kataktabo.